Question 1. A nurse assesses a client 6 hours post-admission with suspected infection. Vital signs are T 37.8 degrees Celsius, heart rate 96, respiratory rate 24, blood pressure 104/68, SpO2 95%. Which finding most strongly indicates early sepsis despite relatively stable vital signs? A. Respiratory rate 24 per minute. B. Lactate level 3.6 mol per liter. C. Heart rate below 100 per minute. D. Oxygen saturation above 94%. Answer. B. Lactate level 3.6 mol per liter. Rationale. Elevated lactate reflects tissue hypoperfusion and can precede hypotension. Subtle sepsis often presents before dramatic vital sign changes, making lactate a critical early indicator. Question 2. The nurse receives multiple orders for a newly identified septic client. Which action requires the nurse to intervene immediately if delayed? A. Initiation of broad-spectrum IV antibiotics. B. Measurement of central venous pressure. C. Administration of antipyretics. D. Chest radiography. Answer. A. Initiation of broad-spectrum IV antibiotics. Rationale. Mortality increases with each hour antibiotics are delayed. Diagnostic and supportive measures must not postpone antimicrobial therapy. Question 3. A client with sepsis received 30 milliliters per kg of IV fluids. Which findings indicate inadequate response and progression toward septic shock? Select all that apply. A. MAP 58 millimeters of mercury. B. Urine output 15 milliliters per hour. C. Lactate increased from 3.1 to 4.0 mol per liter. D. Heart rate decreased from 122 to 104 per minute. Answer. A. MAP 58 millimeters of mercury. B. Urine output 15 milliliters per hour. C. Lactate increased from 3.1 to 4.0 mol per liter. Rationale. Persistent hypotension, worsening lactate, and oliguria indicate refractory shock. A reduced heart rate alone does not confirm improvement. Question 4. Which assessment finding requires the nurse to escalate care immediately rather than continue routine monitoring in a septic client? A. New onset confusion. B. Temperature 38.2 degrees Celsius. C. Heart rate 108 per minute. D. WBC 14,000 per cubic millimeter. Answer. A. New onset confusion. Rationale. Acute mental status change signals cerebral hypoperfusion and evolving organ dysfunction, requiring rapid intervention. Question 5. The nurse evaluates lab results for a client with suspected sepsis. Which combination most strongly supports the diagnosis of severe sepsis? A. Elevated lactate and decreased urine output. B. Fever and leukocytosis only. C. Elevated hemoglobin and platelets. D. Normal blood pressure and tachycardia. Answer. A. Elevated lactate and decreased urine output. Rationale. Evidence of organ dysfunction plus infection defines severe sepsis. Isolated inflammatory signs are insufficient. Question 6. After initial interventions, which reassessment finding best indicates effective tissue perfusion? A. Lactate trending downward. B. Temperature returning to normal. C. Decreased pain score. D. Improved appetite. Answer. A. Lactate trending downward. Rationale. Lactate clearance reflects improved cellular oxygenation and perfusion, the most meaningful marker of response. Question 7. Which nursing judgment best reflects prevention of sepsis-related mortality? A. Early recognition and escalation of care. B. Strict intake and output monitoring only. C. Fever management. D. Patient comfort measures. Answer. A. Early recognition and escalation of care. Rationale. Survival in sepsis depends on early detection and rapid intervention before shock develops. Question 8. Which client presentation requires the highest suspicion for sepsis despite minimal symptoms? A. Older adult with diabetes and mild confusion. B. Young adult with high fever and chills. C. Middle-aged client with hypertension. D. Postoperative client with pain. Answer: A. Older adult with diabetes and mild confusion. Rationale: older adults may lack classic signs and present with subtle neurologic changes as the first indicator of sepsis. Question 9. A septic client suddenly becomes restless and disoriented. What is the priority nursing interpretation? A. Decreased cerebral perfusion. B. Adverse medication effect. C. Anxiety response. D. Sleep deprivation. Answer: A. Decreased cerebral perfusion. Rationale: neurologic changes in sepsis signal hypoxia or hypoperfusion and must be treated as organ failure. Question 10. Which provider order should the nurse question in a client with fluid refractory septic shock? A. Initiate norepinephrine fusion. B. Continue IV fluids cautiously. C. Delay vasopressors until blood pressure normalizes. D. Insert arterial line. Answer: C. Delay vasopressors until blood pressure normalizes. Rationale: vasopressors are required when hypotension persists after fluids. Delaying worsens tissue ischemia. Question 11. True or false? Absence of fever excludes sepsis in immunocompromised clients. A. True. B. False. Answer: B. False. Rationale: immunocompromised and older adults may not mount a febrile response despite severe infection. Question 12. When communicating with the provider using SBER, which data most urgently belongs in the assessment section? A. Rising lactate and MAP 58 millimeters of mercury. B. Past medical history. C. Length of hospital stay. D. Family concerns. Answer: A. Rising lactate and MAP 58 millimeters of mercury. Rationale: critical physiologic instability must be communicated immediately to prompt rapid intervention. Question 13. Which nursing action best reduces preventable harm during sepsis management? A. Continuous reassessment after each intervention. B. Minimizing lab draws. C. Delaying invasive monitoring. D. Encouraging oral intake. Answer: A. Continuous reassessment after each intervention. Rationale: sepsis is dynamic. Frequent reassessment detects deterioration and guides timely escalation. Question 14. A septic client's urine output falls to 10 milliliters per hour. What is the priority clinical interpretation? A. Renal hypoperfusion and organ dysfunction. B. Dehydration only. C. Normal aging change. D. Bladder obstruction. Answer: A. Renal hypoperfusion and organ dysfunction. Rationale: oliguria in sepsis reflects decreased renal perfusion and evolving acute kidney injury. Question 15. Yes or no? Should antibiotic administration be delayed if blood cultures are difficult to obtain? A. Yes. B. No. Answer: B. No. Rationale: antibiotics must not be delayed beyond recommended timeframes, even if cultures are challenging to obtain. Question 16. Which ethical principle primarily supports rapid initiation of aggressive sepsis treatment? A. Beneficence. B. Autonomy. C. Justice. D. Veracity. Answer: A. Beneficence. Rationale: acting to prevent harm and preserve life aligns with beneficence in emergency conditions. Question 17. Which outcome most accurately reflects effective sepsis management? A. Stabilized MAP and decreasing lactate. B. Reduced fever. C. Improved comfort. D. Normal WBC count alone. Answer: A. Stabilized MAP and decreasing lactate. Rationale: hemodynamic stability and improved perfusion are the strongest indicators of recovery. Question 18. Which findings require immediate activation of a rapid response in a septic client? Select all that apply. A. MAP 55 millimeters of mercury. B. New confusion. C. Rising lactate trend. D. Afebrile status. Answer: A. MAP 55 millimeters of mercury. B. New confusion. C. Rising lactate trend. Rationale. These findings indicate worsening shock and organ dysfunction requiring urgent escalation. Question 19. True or false? Normal blood pressure rules out septic shock if lactate is elevated. A. True. B. False. Answer: B. False. Rationale. Compensated shock may maintain blood pressure despite poor tissue perfusion and elevated lactate. Question 20. Which outcome best demonstrates effective interprofessional sepsis care? A. Antibiotics administered within 1 hour with lactate improvement. B. Completion of documentation. C. Family education completed. D. Transfer without delay. Answer: A. Antibiotics administered within 1 hour with lactate improvement. Rationale. Timely coordinated care resulting in physiologic improvement reflects effective teamwork and clinical judgment. Question 21. A nurse is monitoring a client with suspected sepsis whose blood pressure remains 112 over 70 millimeters of mercury. Which finding most strongly indicates occult septic shock? A. Lactate 4.5 mol per liter. B. Heart rate 102 per minute. C. Temperature 38.1 degrees C. D. WBC 12800 per cubic millimeter. Answer: A. Lactate 4.5 mol per liter. Rationale. Elevated lactate reflects cellular hypoxia despite normal blood pressure, indicating compensated or occult shock. Question 22. Which nursing action demonstrates the highest level of clinical judgment when managing a deteriorating septic client? A. Activating rapid response before hypotension occurs. B. Increasing oxygen flow rate. C. Rechecking vital signs in 30 minutes. D. Documenting assessment findings. Answer: A. Activating rapid response before hypotension occurs. Rationale. Anticipating deterioration and escalating care early prevents progression to irreversible shock. Question 23. A septic client received fluids and antibiotics. Which findings indicate worsening organ dysfunction? Select all that apply. A. Urine output 18 milliliters per hour. B. Rising creatinine level. C. Platelet count decreasing. D. Temperature normalizing. Answer: A. Urine output 18 milliliters per hour. B. Rising creatinine level. C. Platelet count decreasing. Rationale. Oliguria, renal impairment, and thrombocytopenia indicate worsening multi-organ dysfunction. Question 24. The nurse notes mottled skin and delayed capillary refill in a septic client. What is the priority interpretation? A. Peripheral tissue hypoperfusion. B. Normal aging changes. C. Allergic reaction. D. Dehydration only. Answer: A. Peripheral tissue hypoperfusion. Rationale. Poor peripheral perfusion is a late and ominous sign of shock requiring immediate intervention. Question 25. Which assessment finding should prompt immediate initiation of vasopressor therapy after adequate fluid resuscitation? A. MAP 60 millimeters of mercury. B. Temperature 38.5 degrees Celsius. C. Heart rate 110 per minute. D. WBC 15,000 per cubic millimeter. Answer: A. MAP 60 millimeters of mercury. Rationale. Persistent hypotension after fluids indicates septic shock and need for vasopressors. Question 26. A nurse is prioritizing care for 4 clients. Which client should be assessed first? A. Septic client with new confusion and rising lactate. B. Febrile client awaiting cultures. C. Client receiving IV antibiotics. D. Client with controlled pain. Answer: A. Septic client with new confusion and rising lactate. Rationale. New neurologic changes and worsening perfusion signal life-threatening deterioration. Question 27. Which laboratory trend best indicates failure of sepsis treatment? A. Lactate continues to rise. B. Temperature decreases. C. WBC count stabilizes. D. Heart rate slows. Answer: A. Lactate continues to rise. Rationale: persistent or rising lactate reflects ongoing tissue hypoxia despite treatment. Question 28. A septic client develops tachypnea with normal oxygen saturation. What is the best nursing interpretation? A. Compensatory response to metabolic acidosis. B. Anxiety response. C. Pulmonary embolism. D. Pain-related breathing. Answer: A. Compensatory response to metabolic acidosis. Rationale: tachypnea compensates for lactic acidosis by reducing carbon dioxide levels. Question 29. True or false? A decreasing blood pressure is always the first sign of septic shock. A. True. B. False. Answer: B. False. Rationale: shock may be present before hypotension due to compensatory mechanisms. Question 30. Which intervention most directly supports prevention of sepsis-related acute kidney injury? A. Maintaining adequate perfusion pressure. B. Administering antipyretics. C. Restricting fluids. D. Delaying nephrotoxic drugs only. Answer: A. Maintaining adequate perfusion pressure. Rationale: renal perfusion depends on adequate blood pressure and circulation. Question 31. A nurse evaluates response to vasopressor therapy. Which finding indicates the intervention is effective? A. MAP increases to 68 millimeters of mercury. B. Heart rate increases. C. Temperature normalizes. D. WBC decreases. Answer: A. MAP increases to 68 millimeters of mercury. Rationale: vasopressors aim to restore perfusion pressure to vital organs. Question 32. Yes or no? Should worsening mental status in sepsis be considered an emergency even without hypotension? A. Yes. B. No. Answer: A. Yes. Rationale: neurologic changes reflect cerebral hypoperfusion and require immediate escalation. Question 33. Which nurse statement best reflects ethical clinical judgment in sepsis care? A. Early treatment is necessary to prevent irreversible harm. B. We should wait for all lab results. C. The fever must be controlled first. D. Family consent is required before antibiotics. Answer: A. Early treatment is necessary to prevent irreversible harm. Rationale: acting to prevent harm aligns with beneficence in life-threatening conditions. Question 34. Which findings indicate progression toward multiple organ dysfunction syndrome MODS? Select all that apply. A. Rising bilirubin. B. Decreasing platelet count. C. Worsening creatinine. D. Improving oxygen saturation. Answer: A. Rising bilirubin. B. Decreasing platelet count. C. Worsening creatinine. Rationale: MODS affects multiple systems, including hepatic, hematologic, and renal function. Question 35. Which outcome best confirms high-quality sepsis care delivery? A. Timely bundle completion with lactate clearance. B. Absence of fever. C. Shorter hospital stay only. D. Patient satisfaction scores. Answer: A. Timely bundle completion with lactate clearance. Rationale: evidence-based bundle adherence with physiologic improvement reflects optimal care. Question 36. A 72-year-old client with pneumonia is admitted. Vital sign: temperature 37.6 degrees Celsius, heart rate 98, respiratory rate 26, blood pressure 118/72, SpO2 94%. Labs show lactate 3.9 mol per liter. Which nursing judgment best reflects recognition of sepsis? A. Monitor closely and reassess in 1 hour. B. Activate sepsis protocol despite stable BP.C. Administer antipyretics. D. Encourage oral fluids. Answer: B. Activate sepsis protocol despite stable blood pressure. Rationale: elevated lactate with tachypnea indicates occult sepsis. Waiting for hypotension delays life-saving treatment. Question 37. A septic client received IV fluids and antibiotics. Which findings indicate failure to rescue? Select all that apply. A. Lactate increases from 3.2 to 4.6 mol per liter. B. Urine output decreases to 12 milliliters per hour. C. MAP remains 62 millimeters of mercury. D. Temperature decreases to 37 degrees Celsius. Answer. A. Lactate increases from 3.2 to 4.6 mol per liter. B. Urine output decreases to 12 milliliters per hour. C. MAP remains 62 millimeters of mercury. Rationale. Worsening lactate, oliguria, and hypotension signal inadequate response and impending shock. Question 38. A nurse must decide whether to escalate care. Which single cue carries the highest weight in sepsis-related clinical judgment? A. Rising lactate trend. B. Elevated temperature. C. Tachycardia. D. Leukocytosis. Answer. A. Rising lactate trend. Rationale. Lactate reflects tissue perfusion and predicts mortality more accurately than inflammatory signs. Question 39. A client with sepsis develops sudden tachypnea, normal SpO2, and decreasing bicarbonate. What is the priority interpretation? A. Compensatory respiratory alkalosis for metabolic acidosis. B. Pulmonary embolism. C. Anxiety-induced hyperventilation. D. Pain response. Answer. A. Compensatory respiratory alkalosis for metabolic acidosis. Rationale. Sepsis causes lactic acidosis. Tachypnea compensates by reducing CO2. Question 40. The nurse reviews orders for a client in septic shock. Which order should be implemented first? A. Start norepinephrine infusion. B. Obtain repeat blood cultures. C. Administer acetaminophen. D. Insert urinary catheter. Answer. A. Start norepinephrine infusion. Rationale. Persistent hypotension after fluids requires immediate vasopressor support to preserve organ perfusion. Question 41. True or false? Normal mental status rules out early organ dysfunction in sepsis. A. True. B. False. Answer. B. False. Rationale. Organ dysfunction may exist before neurologic changes become evident. Question 42. A nurse caring for 4 clients recognizes which scenario as the highest priority? A. Septic client with MAP 58 millimeters of mercury and rising lactate. B. Client with fever awaiting antibiotics. C. Client with stable vitals on IV antibiotics. D. Client with improving urine output. Answer. A. Septic client with MAP 58 millimeters of mercury and rising lactate. Rationale. Hypotension and worsening perfusion indicate life-threatening shock. Question 43. Which combination of findings most strongly indicates progression toward MODS? Select all that apply. A. Rising bilirubin. B. Decreasing platelet count. C. Worsening creatinine. D. Resolving leukocytosis. Answer. A. Rising bilirubin. B. Decreasing platelet count. C. Worsening creatinine. Rationale. Multisystem lab deterioration indicates MODS. Question 44. A septic client's blood pressure is 110/70, but lactate is 4.8 mol per liter. What is the most appropriate nursing action? A. Escalate care and notify the provider immediately. B. Continue routine monitoring. C. Recheck lactate in 6 hours. D. Administer antipyretics. Answer. A. Escalate care and notify the provider immediately. Rationale. Elevated lactate signals tissue hypoxia despite normal BP, occult shock. Question 45. Yes or no? Should vasopressors be delayed if urine output is decreasing but blood pressure is normal? A. Yes. B. No. Answer. B. No. Rationale. Decreasing urine output indicates hypoperfusion even without hypotension. Question 46. Which nurse response best demonstrates high-level ethical clinical judgment in sepsis? A. We must act now to prevent irreversible organ damage. B. Let's wait for all diagnostic confirmation. C. Family consent is required before treatment. D. The fever needs to be treated first. Answer: A. We must act now to prevent irreversible organ damage. Rationale: beneficence supports rapid intervention in life-threatening conditions. Question 47. A nurse evaluates sepsis bundle compliance. Which outcome best reflects effectiveness? A. Lactate clearance and stabilized MAP. B. Fever resolution. C. Normal WBC count. D. Reduced pain score. Answer: A. Lactate clearance and stabilized MAP. Rationale: improved perfusion markers indicate meaningful physiologic recovery. Question 48. Which assessment finding most strongly predicts increased mortality in sepsis? A. Persistent elevated lactate. B. Fever. C. Tachycardia. D. Leukocytosis. Answer: A. Persistent elevated lactate. Rationale: lactate persistence correlates directly with poor outcomes. Question 49. True or false? Improvement in vital signs alone confirms resolution of septic shock. A. True. B. False. Answer: B. False. Rationale: cellular hypoxia may persist despite normalized vital signs. Question 50. Which outcome best demonstrates expert-level interprofessional sepsis management? A. Rapid escalation, timely antibiotics, and improving organ function. B. Completion of all documentation. C. Family education completed. D. Transfer to ICU alone. Answer: A. Rapid escalation, timely antibiotics, and improving organ function. Rationale: coordinated, timely action resulting in physiologic improvement defines high-quality sepsis care. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.